Today on the Compliance Leadership Lounge.
Compliance is a way to secure the money that you have earned in a correct manner so that you can continue to grow and do the business the right way.
What I found when I got into that leadership position was my ability to be able to affect change and be an advocate, not just for patients, but for my team that was working on the front lines. You
Right.
need to be showing an effort that you're trying to separate those functions and be respectful of those individuals' responsibilities.
If I can mitigate risk issues for the organization through clinical care, getting the right people in, getting the right people to do the right stuff, preventing issues from happening or incidents from happening on a risk management. Once we stop talking about compliance as being a cost center and start saying compliance is here to help us keep the money we have legitimately earned.
Welcome to the Compliance Leadership Lounge with host Ross Ronan, your guide for insightful discussions in healthcare compliance. In our lounge, leaders and experts gather together to share their perspectives and wisdom. So grab a chair, make yourself comfortable, and join the conversation as we dive into the strategies and stories behind effective compliance leadership. Whether you're a CEO, board member, or a compliance enthusiast, you're in the right place to learn, grow, and lead with integrity.
Welcome, Christina, to the Compliance Leadership Lounge. Thanks for joining me today.
Thanks for having me.
Of course. Now, Christina is the newest member of Ronan Healthcare Compliance, and we're so fortunate to have her join our team. And I'd love to hear a little bit about your history, your background, where you came from. I know it all, but they don't know it. So I'd love to hear it from you.
I'm a mystery. Well, I am a registered nurse by trade. I worked in the healthcare industry at bedside for roughly 15 years and just sort of by happenstance was offered an opportunity in healthcare leadership. Of course, I was told it was an interim opportunity, but we all know that interim typically turns to permanent. So it's more of a voluntold situation more than anything. But I really appreciate that opportunity because, I was really not much of an advocate for leadership. I was more of an advocate for patient care and my colleagues that were at the bedside. But what I found when I got into that leadership position was my ability to be able to affect change and be an advocate, not just for patients, but for my team that was working on the front lines. When you have a bunch of folks higher up that are making decisions and they don't understand the impact of those decisions on frontline operations. So I really took and owned that and ran with it. And things just really grew from there. And just as I was sort of falling in or happenstance into that leadership opportunity, so did my transition to compliance. And I think you said it one of the first times that we met. I don't know too many compliance professionals that actually wake up one morning and say, I'm going to be a compliance professional. It's more, you stumble into it, it finds you. So
it sure does. Yeah, that's what I tell everybody. But I think nowadays, people are actually looking more for compliance realm, which is compliance roles, because I think that's really interesting when they offer it in schools, they offer it as a bachelor's or as certifications. They didn't have that kind of stuff back in the day. But I do find people are heading more towards it. But in my opinion, like I said, compliance chooses you. You don't choose compliance. And 9 times out of 10, if you choose compliance, you're probably not going to stay in it for very long.
Yeah, true.
Because it's painful, right? People are not necessarily
You don't have too many cheerleaders in the compliance circle.
You don't, especially when people kind of stop talking when you walk by. If you're the wrong compliance executive, right? If you're the right one, they go, come over here, let's talk about the things that we need to talk about. So it's funny that you fell into it like the rest of us.
Well, I'm sure you had experiences as a nurse with Joint Commission surveyors and other surveyors in the industry. My first few experiences with them, we scattered like cockroaches. We didn't want to have anything to do with surveyors when they walked on the floor. And I think Joint Commission and other regulatory agencies changed that approach to be, it's more of a learning opportunity now. And I really connected with that. That was something that resonated with me. And so I adopted that. I think it's important. I was the one as a nurse that was creating all the workarounds and finding the loopholes in the policies. And
you had to get stuff done.
Had to get it done. And working in organizations that were heavy on policy, it just was not feasible for efficient care and efficient workflows and patient safety. So naturally, I figured I'd be a good fit for compliance because I can help you
Quality
build
or
better,
compliance is
better
where you kind of fall
policies.
in.
Yes, yes.
So since Compliance Leadership Lounge is really about leadership, and you said you talked through your history of getting into leadership, whether it's clinical leadership and then moving into compliance roles. What's your favorite book on leadership, and how it motivates you and inspires you to be a good leader?
Wow, so I've read many, many books over my career, and I have many still in my library that I want to get to someday. But I think the most impactful and influential has been Crucial Conversations.
Okay.
And I know that in nursing and healthcare leadership, you're dealing with, disgruntled families, sick patients. You need to have the right tone, the right approach to having difficult conversations. And then the same goes on the compliance side of things, and having tough conversations with your board, having tough conversations with your executive team, being able to shift your tone and your tenor and your approach with frontline leadership or folks that are in the field. So that book has had a profound impact on how I approach things. And I often go back and reference it to this day, if I'm anticipating a difficult conversation on the horizon.
Well, it's interesting because one of the core aspects that I usually talk about with leadership is communication, right? If you're transparent and you can have those effective communications with people, whether it's your board, whether it's your CEO, whether it's someone who reports to you, that's good leadership, right? They can effectively communicate. And I still struggle with it today. To me, I always work on everything to be a better communicator, because once people know where you're coming from, you can answer the questions correctly.
Right.
Then people see you in a sign of authoritative figure who knows what they're doing and knows what they're talking about. And they want to lead. They want to follow that lead. Right. If you can communicate well.
Absolutely.
So, great. Well, let's move on to what we're talking about today in the General Compliance Program Guidance from the OIG that came out in November of 2023. The GCPG, as they refer to it a lot. So that's kind of how we'll refer to it as well. Talk about a little bit about what you've been reading in the GCPG or what you've heard from the OIG. I did have an opportunity to attend HCCA's conference where Laura Ellis and Amanda Copsey, the two from the policy branch of the OIG, had spoken. And Amanda and I are acquaintances from my past history of being on corporate integrity agreements. She was on the CIA monitor list. And so she was one of my monitors at one point in time. So we do have a good relationship. We got to listen to their kind of highlights of what they think the changes have been made, which I encourage anybody who's out there, whether you're a board member, a CEO, or a compliance executive, to go read the GCPG. But I want to know, kind of from your standpoint and a little dialogue, what do you think the biggest changes are that affected you as a compliance executive that really you've put into motion in your practice as a compliance officer?
Well, that's an interesting question. I would say, the OIG and the DOJ updates, they're married to one another, so to speak. So we've had so many advances in data-driven technology, AI, and the introduction of that into every aspect of our organizations. So I believe that they are expecting compliance programs to be more data-driven, more real-time and accessible that way. It's actively evolving based on the risks that are coming out, within your industry and just healthcare as a whole. And then the most interesting piece is, I think at least, is the incentivizing for whistleblowers. Yeah. Actually providing an incentive to people coming forward, in addition to allowing that protection, whereas disincentives was more the focus before, and clawbacks and things like that. So I think that that's going to be an interesting piece, and we'll see if it provokes and promotes more people to come forward.
What I think is really interesting is they have not come out with program guidance since I think 2005, 2006, somewhere around there. And I had someone tell me the other day that I was a Gen 1er as a compliance officer, which really hurt me bad. But it was around the time when they started coming out with the program guidance. I think the first one was like 97, 98, somewhere around there. And then they put together the various program guidances for small physician practices, third-party billing companies, hospitals, hospice, whatever you want to call it, in the later years. So I think this is the first time the OIG has started to use and consolidate everything that they've talked about over the years between the time that they set the program guidance in the first place to today, right? What I think is really important is now that they've come out with a GCPG, they're putting more emphasis on compliance programs in healthcare and letting people know that, hey, yes, we had a lag there from like 98 to 2005 when we put out everything. And then we were all just supposed to comply with it for the last 20 years. And now they come back and say, hey, we're going to redo this because there needs to be a re-emphasis or more of an emphasis on these compliance programs. And here's what we want you to do. So I think it's really interesting that they're starting to do this. And this is one of like 5 or 6, I think they're putting out now. And we're going to see this kind of progress throughout the years. So I agree with you 100% how it's going to change and how the intricacies of what's in it, like data analysis and artificial intelligence, how you should set up your compliance program are very crucial to what this means.
Well, Ross, I have a question for you. How do you interpret the OIG's interpretation of accountability and how that plays in?
Accountability is really important when it comes to the compliance program, and the GCPG talks about how accountability should be implemented within an organization. So if there are organizations out there who don't really want to have a compliance program or really put it into effect, then the GCPG kind of is the roadmap to say, this is what the government's looking at when they come in and take a look at you. And we want to make sure that you are following it. So I think it really strengthens a compliance program's ability to do what they need to do and be accountable for their organization. So how does the OIG address leadership and governance in the GCPG? Because they do address a lot of things, in my opinion, that originally were saved for corporate integrity agreements versus the program guidance when it comes to kind of leadership roles and who should be reporting to whom and how it should be effective. So talk a little bit about what they address in the leadership governance piece.
So there was a big emphasis or continued emphasis on the compliance officers' reporting responsibilities and their line of authority. And, CCOs, the chief compliance officers, your compliance resources, they really need to be independent, and they need to be independent to provide certain levels of objectivity when they're trying to, execute on and operationalize a company's program. So, I think that demonstrates the importance of having a chief compliance officer and those that report into the compliance department as a sole resource. And then also having that function being separate and apart from legal, finance, operations, right? Legal's responsibility is to do what? Is to focus on protecting the organization. Operations, they're focusing on priorities and running a business and making money. And obviously the CFO is focusing on what they're focusing on. So you want to be able to pull that individual and those that are responsible for that program out of the oversight and out of the thumb of others, if you will.
Yeah. When I think about it, and they did a really good job of laying it out. And again, these are recommendations. I always say that they're recommendations, not requirements, which means that when they come in, they have an expectation of you guys following all of this stuff, everybody following it.
Right, but in your own way, right?
In your own way, right? In their guidelines, but there's still a requirement to have a compliance program under the Affordable Care Act. So you still have to have one. These are just recommendations on how to do it. But for years, under corporate integrity agreement, because I've had many of them in my lifetime, this is what they said. Thou shalt not report to the chief legal officer or general counsel, and thou shalt not report to finance, where they added in operations here, which was very interesting into the GCPG. But, in the past, it was just strictly for corporate integrity agreements. And this whole focus on general counsels are very interesting. I think, as we were talking earlier, they say it's okay to be the general counsel or compliance officer, but just for a very short period of time while you're trying to figure it out.
You need to be showing an effort that you're trying to separate those functions and be respectful of those individuals' responsibilities.
And it really comes down to a conflict of interest in my mind. If you really want to talk about it, it is whatever position that person is in. And I think the OIG would agree with this, is it puts you in a position that if I'm ever put in a compromised position, a conflict of interest, my decision should be based upon compliance and compliance only, not on some other driving factor like operationally, are things working, financial, am I getting paid for things, or legal, do I have a attorney-client privilege issue
Right.
that I have to deal with on a business standpoint?
Exactly.
So they really do a very good job of kind of outlining that. One thing that I really wish they would have done was talk a little bit about when the compliance program or the compliance officer does administratively report to the general counsel, because there's only probably so many people who can directly report to the CEO, but it's about unrestricted access to that individual, right? And the board versus just this direct reporting line. And so many compliance officers take it so literally where they're
And
like,
even on paper, they report into counsel that they don't feel that they have the access that they need to.
Exactly.
Right.
And if you're like, I don't have that straight line to the CEO, therefore it doesn't work. That's not the answer to the question. The answer to the question is, can I pick up the phone and have a conversation with the CEO outside of anybody else? And if that answer is yes, then I think you meet the criteria that the GCPG was really trying to go after, of saying unrestricted access, you get to report to the highest levels of the organization, and they then, CEO, board, whomever, become accountable for whatever happens at the organization, and you still stay independent.
Now, conversely, though, so your compliance function understands that and accepts that. But on the opposite end of it, your chief executive officer, your chief legal officer, they're more of, well, on paper, though, you don't technically report to me. So how would you navigate a situation like that?
And when you mean they say it's on paper, what are you referring to?
So if they're putting up a barrier at that point, they're putting up a hurdle, right? They want to be able to filter what you're bringing to the board, or filter what you're bringing to that chief executive. How can compliance officers that understand, look, if my current situation is I'm reporting into legal, but that legal function is taking that literally, right? And they're not recognizing that I should have direct access to the CEO when I need to, direct access, unfettered access to that board when I need to. I guess the best way is to work through that.
Well, that's restricted access, right? So if I have to run everything through my GC to my CEO, that's okay. I don't have a problem with that. But if it's something that I feel is very important to be able to have a conversation with my CEO, and the general counsel says no, there it becomes a restriction, right? So then it fails.
Right.
And that's exactly what they're referring to, right? Especially if you're a CFO and you want to say your compliance reports to me and you've identified an overpayment, right? And you're like, hey, we got to give all this money back. That's not a CFO's favorite thing to hear, right? And 9 times out of 10, they're like, can I have another way, right?
Yeah.
And there becomes a conflict of interest. And if I have a reporting relationship to the CEO, my response is, I got to tell the CEO. And if somebody stops me from doing, that's restricted access, and that's where it fails. So general counsel should know this. And when they set up the infrastructure around who's reporting to them for their own protections, right? Because there's a lot of general counsels who have been indicted, who have been, co-general counsel, co-compliance officers who have been sued by the federal government in a False Claims Act and a QTAM situation. General counsel should know this because it puts them in a exposed situation as well, where if they have been restricting communications up to the highest level, they then become accountable for that, and they can be sued by the federal government or indicted for any kind of criminal behavior. So when we talk to general counsels who have compliance reporting to them, we make it very clear that that's fine, that's great, I think that's okay. But and especially if it's us that we're outsourced compliance officers, the first thing that I say is I need the CEO's phone number because I need to be able to pick it up.
Right.
And if you don't give it to me and you're not letting me have that, then it's unrestricted. That's not unrestricted access. That is restricted. And it really is about a conflict of interest. And the GCPG, in my opinion, doesn't take it far enough to really focus in on, is there a conflict or is there not a conflict? And I've had conversations with CEOs who are like, I trust my general counsel. They're the greatest. They would tell me everything that they need to know. And you're like, Yes, but you also want everything to be attorney-client privilege and not
Exactly.
communicated. So.
Exactly. Right.
It's great. All right, moving on. So they talk a little bit more about risk assessments in the GCPG, where they've even changed the element to auditing, monitoring, and risk assessments.
Some even argue that's the 8th element out of your 7 elements, but yeah.
And it's interesting. And let's not confuse the world, because everything we've done around 7 elements, right? So I just added to the auditing and monitoring piece of it. They've always talked about risk assessments.
Mm-hmm.
We've always talked about how you should do it. And it's different than an enterprise risk assessment that companies are doing across the board to say, where your different exposures. This is really a compliance risk assessment where you come in and you're like, hey, is my compliance program working? Do I have gaps in this? Is it operationalized? Are we looking at the different areas of exposure from a compliance perspective?
This episode of the Compliance Leadership Lounge is brought to you by Ronan Healthcare Compliance. At Ronan Healthcare Compliance, we believe in transforming healthcare compliance from a checkbox attitude to a strategic advantage. With decades of expertise, our team provides innovative solutions tailored to your organization's unique needs. We don't just help you meet your standards, we elevate your business, ensuring ethical practices are at the heart of what you do. Whether you're navigating complex regulations or seeking to enhance your compliance strategy, Ronan Healthcare is your partner in achieving excellence in healthcare compliance. Ronan Healthcare Compliance, redefining compliance, empowering leadership. Visit us at ronanhc.com to learn more. Now, back to the show.
Talk a little bit about what that means to you from the standpoint of the auditing and monitoring program and putting in a risk assessment.
Historically, at least when I was growing up as a young compliance professional, risk assessments were saved it was an annual process, right? And now the guidance is we really need to be thinking about risk in real time. And, so that means that compliance program risk assessments should be evolving and should not be something that's static year over year. Mm-hmm. So that then changes, right, how you approach and how you prioritize and operationalize your auditing monitoring program. So as the OIG or DOJ or others come out with updates for the year, it's important for compliance officers and other compliance professionals just to be acutely aware of those, so that they are actively updating in real time your risk assessment and in your auditing and monitoring efforts, along with your policies and procedures and your training efforts and everything that goes along with it.
I think the risk assessment process, in my mind, kind of goes along with the work plan, right? Mm-hmm. And the work plan, I think a lot of compliance professionals miss the mark on a work plan. I think a lot of them want to put the 7 elements into a work plan, and that's the core being of what you do. And the work plan is what you're going to do on top of that, what mm-hmm. are the other work items that you're going to do. And when we talk about a risk assessment, I think finding out those areas of potential exposure that should feed into your work plan is crucial. It should. We have 3, right? We have 3 areas of our work plan, and I highly recommend anybody to put their work plan in this manner: OIG guidance or any third-party guidance, mm-hmm. OIG work plan items, to anything compliance officers or compliance program has identified through audits or whatever. And 3 is the risk assessment, which is what is the company worried about? And those, to me, are one of the most important things. And I think the GCPG really does want to incorporate that into the auditing and monitoring pieces of it so that you understand what everybody else is worried about within the organization.
And you say everybody else, you're not limiting that risk assessment or those compliance identified items to things that were written into that risk assessment, right, or that were reported during that risk assessment process. So we should be looking at things like your disclosure program, anything that's coming through on patient complaints and the patient care side of things. So there's a whole host of other factors that should be included in those program updates.
Yeah, I love the fact that they've put it all together and created this nice cohesive flow, because we oftentimes miss the mark on risk assessments. Yeah. When it comes to auditing and monitoring, we they don't really talk about it too much here, but when we say about how the world is changing with healthcare. We're in this fee-for-service monologue of what it's been going on for the last hundreds of years or whatever fee-for-service has been around, right? Medicare's, I guess, been around since the 50s. Nobody fact checked me out there. So it's really only been around for that long. So when we talk about that, fee-for-service has been around for a long time. We have this value-based type of issues that we are dealing with. And in the GCPG, they do reference the value-based auditing and monitoring pieces of it. How do you think that's going to go?
That's an interesting point that you bring up. And it's a question that's kind of been weighing on my mind. And I'm reading a lot into, or more of the details into what the government's, what that paradigm shift, right? What they really want Medicare beneficiaries or healthcare organizations to adopt a value-based care approach. So I'm curious from your perspective, what do you think the risks are for compliance professionals? Or are we going to make that 2030 mark, right? That's what the government has laid down as our due date. Do you think that we're going to get there? And if we do, what does that risk landscape look like for us?
The Affordable Care Act came out, 8-9 years ago, somewhere around there, maybe 10 years ago, 2 election terms. That's when the ACOs started coming out, and they really started talking about value-based reimbursement. And we're still not there, right? We're still trying to get there. There's a lot more.
I think 2030 is a bit of a stretch.
It's but 6 years, right? So now if you talk about the Affordable Care Act, you're talking, maybe 13, 14, 15 years that it's been in effect, and we're still over 70 years of fee-for-service, right? So really to make that kind of shift in such a short time period I think it's a stretch for us to do that. Do I think it's necessary? 100%. I think it's absolutely necessary. I think fee-for-service is something you do for, being a mechanic or a plumber or electrician. I come and do a job, you pay me for my service, and then I'm done, right? Outcomes are the best way for as nurses.
Totally agree.
Right? We want people to get healthy. We don't want people to stay sick so that they can continue to get reimbursement. We want them to stay healthy so that if something does happen, we can take care of them in a big scheme of things. But we don't want them to return to the hospital. So I do think that value-based reimbursement is the way to go. And from a compliance perspective, when I started as a compliance officer, all the people in compliance were in finance. They were the CFO. They were the controller. This was early 2000s or revenue cycle. And I think the first 2 of my compliance officer jobs, I took away from somebody who was in revenue cycle or someone who was in finance because someone realized that, hey, it can't be this way. And they also were under a corporatity agreement, so they couldn't. So we started getting into it I was a nurse and then also went to law school. So they started looking at it as, hey, we want somebody else other than finance. And that transitioned a lot into legal. So we kind of went from finance to the legal department where it kind of sat for a while until the guidance came out, CIAs came out, GCPG came out, where they said, hey, we are going to now say, don't be part of the legal department. It's a whole different issue. You're trying to protect everything, attorney-client privilege. So then we saw this shift kind of away from the legal department into this kind of more independent type of individual. And we've seen anybody from their masters in psychology to nurses to doctors to whatever. I think the next phase is going to be with the value-based reimbursement. Compliance and compliance officers are going to have to transition from a true clinical approach. So if there's nurses, doctors, PTOTs, whoever is out there and thinking they really want to get into compliance, I think the value-based reimbursement is the place to be because we talk about ACOs and having patients taken care of from A to Z. And every one of those aspects are covered in a clinical care. So it's nurse, doctor, PT, they all cover this under an accountable care organization. And that's really where it's going to be. And we know the 5 elements for a compliance program for an ACO. It's a little different, right? We have to look at diagnosis codes. We have to look at risk factors and things like that. But I think it's going to take more of a clinical approach. I don't think compliance is going to go anywhere. I think it's going to shift from the standpoint of who does it and how much you know. And then maybe people who are not so clinical might have a little bit of a disadvantage in the compliance role.
Yeah, I would agree. I also read recently the concept of maybe not merging, but melding or your compliance and your quality resources working sort of in lockstep with one another. And I think that's going to be an interesting change in the compliance landscape as well, because historically we've been told, your quality and risk function, that should be a separate function from your compliance function. You have your own metrics and issues you need to be monitoring and worry about, and same with compliance. So that's going to be, I think, a very interesting but very necessary shift in leadership and integration of oversight services.
Yeah, and we do a lot with home health and hospice companies, and a lot of home health and hospice programs, because they're so quality driven from the quality perspective, and they do a lot of surveys and site visits from Medicare that really do require a lot of quality measures to take place. They do combine the two a lot, so quality and compliance. And we come in with Ronan Healthcare Compliance, we come in and help them strip the compliance pieces away from the quality, because there's so much to do on a quality standpoint that adding the compliance function on top of that, or putting it together, is just too much. Now, one leader, yes, but the functionality has got to be separated from that perspective. There's just too much to do.
You're diluting. You're absolutely diluting the effectiveness of both sides of that program.
And I remember one time in my history, we were in a corporate integrity agreement, and in the CIA it said, "You shall not do anything else but compliance." Right. And now they put it in the GCPG, but it used to be just in the corporate integrity agreements. And so I called my monitor and I said, "Hey, they want compliance program to take over risk management. What do you think about that? And here's my argument of why it's a good idea." And I said, "Look, if I can mitigate risk issues for the organization through clinical care, getting the right people in, getting the right people to do the right stuff, preventing issues from happening or incidents from happening on a risk management." I started out in risk management before I went to actually compliance. So
good for you.
That's a little nugget. So yeah, I was risk manager for UT Southwestern. And so that's kind of that's my first intro to compliance really is they had a big compliance audit, and my compliance officer was in our unit in our office doing an investigation or producing documents to a CID. So I'm like, what is that guy doing? But that was kind of my first introduction. And so that's the first time I've seen compliance and risk go together. And when they asked me to take over risk management in addition to compliance, I called up the OIG, and the OIG said, "That's a great idea. If you can manage two departments and they can work together to reduce risk and exposure for the organization on clinical, patient care, risk issues, incidents, and you can ensure that those things are not billable to the federal healthcare program or reimbursable, or if something happens up here and it shouldn't have been, you can actually mitigate that. Absolutely great idea. Thank you so much." And I was like, that is awesome. So they really do understand and realize. Adding that third tier to that, the three-legged stool of risk, compliance, and quality under that kind of same umbrella, I think that's the only way it's going to get value-based reimbursement from a compliance. It's going to have to be overarching, lots of different aspects of the compliance functionality. Compliance, quality, and risk are going to be kind of tied at the hip. They don't need to be the same thing. One person does not need to be doing all of that because it's too much. But partnering side by side, working every day, is exactly what they should be doing.
I'm curious, what do you think the resource allocation and what that structure would look like? Because I think for you and I dealt with that and I've dealt with that many times before, is compliance, quality, risk. They're seen as your cost center. You're essentially not producing any revenue for us. So I think is it going to be more complicated? Do you find that those resources are going to be more restricted? Or are they going to be looking for professionals that have the clinical, the quality, and the risk management background that can also, so then your pool of professionals starts to get much smaller?
I think the pool of professionals are going to get smaller because it's going to take the right person to do that job. Just like it takes the right person to be a compliance executive versus a compliance officer. I talk about that a lot. Not everybody can be a compliance executive. I don't think they have to have the right personality, but there's lots of people who can be compliance officers. And the same token goes with, can an executive oversee all three of those functionalities? The right one can, right? But individually, they need to be managed by themselves. And when an organization, especially a healthcare organization, stops thinking about compliance as a cost center and we talk about this a lot. I mean, everybody in the administrative side of it is a cost center. Like, finance is a cost center,
For sure.
right? Mm-hmm. Everybody is. Legal is a cost center. I hate to tell you, they don't generate revenue. Neither does a compliance program. But we often don't say legal is a cost center, legal is a cost center, or HR is a cost center, HR is a cost center. They are, but they're also saving you a lot of money by the things that they're doing. Once we stop talking about compliance as being a cost center and start saying compliance is here to help us keep the money we have legitimately earned. First and foremost, we're providing patient care. 100% quality patient care. Yes, yes, yes. When you put compliance on top of that, it's like, this is how we actually get to keep the money we legitimately earn.
Quality, you're realizing the quality of your revenue in real time.
Absolutely.
And it's not, it's what's recognized today as hitting your bank will be the same that's recognized 6 months from now, 12 months from now, 24 months from now.
You don't want to have to give it all back because you did it wrong in the first place, or the government comes back and says you did it wrong, right? Mm-hmm. So, I mean, you work hard for your money. You don't want to all of a sudden have to go, oh my God, I got to give all this back because I did it wrong, right? No one wants to do that. And it's the same concept. So when we have to start educating our healthcare entities and our healthcare leadership to understand that compliance is not a cost center. Compliance is a way to secure the money that you have earned in a correct manner so that you can continue to grow and do the business the right way. And once we start making that, then quality, risk, compliance don't become a cost center. They become an investment in protecting that organization and empowering them to do great things and grow that organization.
Yeah, strategic enablers.
Absolutely, 100%. All right. So as we wrap up, I really appreciate the conversation today. I always ask all of my guests here, and we've talked about this in the past. What do you do to take care of yourself?
Oh my goodness. My husband and I are we're avid outdoor people, and he and I love being in the boat. We love fishing. We love biking, cycling. I love running, so I'm looking forward to getting back into that. I have 4 fur babies at home, and you know, my decompression usually at the end of the week is I love to entertain people. I love to feed people. We're from the South, so we think that when you have a happy belly, you have a happy person. So I love to cook and love to entertain and feed my neighbors. And I think we enjoy decompressing and spending time with one another.
Well, that's exciting.
Yes.
Well, thank you so much for joining me today.
Thanks for having me.
Appreciate it.
Yeah, this was exciting, and I appreciate it.
Your insight was valuable. Thank you so much.
Thanks, Ross.
Thank you for spending time with us in the Compliance Leadership Lounge with Ross Ronan. If you've enjoyed our conversation, please subscribe, leave a review, and share this podcast with your network. Your engagement helps us continue to bring in-depth and influential content in the world of healthcare compliance. Stay tuned for our next episode where we further explore leadership dynamics and compliance. Until then, remember, effective compliance is about leading with integrity, and leadership is about making a difference.